All right, welcome back to the OR. Tell you about the case we just finished. Right now we're going to do some fat grafting to the face and some laser resurfacing. I have 4 little incisions. You can see one there. I'm just finishing up putting the tumescent solution, which is a combination of lidocaine and epinephrine to prevent bleeding. I'm just putting this in here. We're going to let her marinate for about 10 minutes and then take some fat. I'll show you that, and I'll show you when we inject it in the face, and I'll show you some laser resurfacing. Fat, I showed you this before. This little cannula has little holes that cut going both ways. So we put the syringe and cannula in back and forth, and it's shaving off tiny little granules, lobules, particles of fat tissue. You can see it in there. When we centrifuge it, it will separate the fat from the tumescent solution that we put in there a little bit earlier. And we'll show you that too. Now we have the head prepped and drained. I just did some grafting of the cheeks and the eyelid, the lid cheek junctions, nasolabial folds. This is just some sterile ice gauze. I'm going to do some lips here now. I have a needle hole here and on the other corner. It's an older patient, so before I do the red part of the lips, the vermilion, I'm going to do this part where all the wrinkles are. If I plump that up, it'll help with a lot of the wrinkles. And then also, we won't need to be as aggressive on the laser, which is the next part of this procedure that we're going to do. Here's the fat. We're putting in tiny, tiny, tiny strands of fat like that. Kind of like you do with a filler in the office, except this needs to be spread out in very thin strands because this has to live. So it's like planting seeds. You can't make a big pile of them. I'm going to laser this part of her upper eyelid. I've done a lot of the rest of the face. You're going to see some tightening. Then I'm going to go with a second pass, and you'll see tightening that's about as much as if you do an upper eyelid surgery. Here's the first pass. So you saw the skin tightening and the eyelid move some, right? Mm-hmm. All right, second pass will do more. Okay, so pretty amazing what we can do with the laser, sort of shrink wrapping the skin. This is not the kind of thing that you do and go back to work. We're doing this in the operating room. She's asleep. We just finished some fat grafting. What we're going to do is she's going to go home and she's going to have about 2.5 weeks of putting ointment on her face until she's able to put makeup on and look good.